A seasoned healthcare professional, Coby Simpson, has come forward with accusations against a medical director at an Indiana rehabilitation facility, claiming the doctor's actions contributed to multiple patient deaths. Simpson sat down with WIBC to share his story. So let's go ahead and fast forward to why you're here with WIBC. So you've had a really big situation that just happened to you, or I should say has been kind of growing over the last, several months?
2 months, yes.
2 months, okay. So why don't we start in kind of chronological order in terms of everything that has happened and has led you to you sitting here today.
So in April, I don't know the exact date when I started, but I was contracted through Absolute Best Staffing, which is just a contract agency. So they place you in a place, you get to select it, but one that fits you the best, and you kind of get to select your own pay. So you get paid higher because, again, you're contracted. So you're a 1099 employee, which I've always done that as a nurse. You make the most money doing it, so I just kind of go where the money goes. However, this particular place was close to home, which was why I picked it. And it was still a 45-minute drive, but I was placed at a place called Owen Valley Rehabilitation and Healthcare in Spencer, Indiana. And the first day I had there, it actually went, really well. Most of the time I spent there, I loved it. The patients were amazing. Even the staff. I actually ended up knowing a couple people who worked there. I had worked with them before at another place, so it felt comfortable. And I kind of went, they didn't even train me, so I knew everything from their charting system to how the DON ran things and what she wanted done charting-wise within the charting system. So it's just like I went, off the ground running. So and I think that's why I noticed certain things pretty quickly. There's a doctor there, which happens to be their medical director. Mm-hmm. Her name is Dr. Diane Wells, and she's been serving Spencer for almost 40 years, I think now, or maybe a little longer. Mm-hmm. I had my first encounter with her when I had a patient on the 200 hall. I was actually the only nurse, but I had the 100 hall, and I had to oversee the other hall as well because it was just a QMA. A QMA is a CNA who can pass medications, so they're regulated on what they can do. So a nurse has to be on duty while they pass meds. So patients in a critical state, I'll have to go in there and do assessments and stuff like that. Well, there was one patient, and again, I'll start with patient one. Mm-hmm. This patient had cancer all over, inside and out, skin cancer, was in very bad shape. However, when this patient first got there, this patient was only there for 2 days. And when this patient first arrived, she was talking just fine. And oxygen saturation was doing good. She had some breathing issues. I think we had to give her some treatments. Yeah, we had to give her a few treatments, but other than that handled the issue. And she was only there because the hospital that she had gone to couldn't do a particular type of diagnostic study. And that one, I cannot remember what it was, but they sent her to us because we could then take her to that appointment, right? Mm. That never happened because she was only there for 2 days, and she was prescribed a lot of morphine, in my opinion. So typically, when someone is in that type of condition and they're in a nursing home, they get prescribed to 0.25 mLs of morphine with a concentration of like 100 milligrams per 5 mLs. Mm-hmm. So it's a very low dose. And if I'm not mistaken, I'm sure she was on 1 ml every half an hour. And, she got it every half hour. So wow. When you have those problems with breathing and oxygen desats, Morphine can help with air hunger, but up to a certain point, and then it starts to cause respiratory suppression where they don't breathe as well. And one night, the patient had secretions in her mouth, and you could hear the difficulty breathing that she was having. So I called Dr. Diane Wells, and this was the first time I'd ever talked to this doctor. I'd never even seen her yet. I mean, I'd only been working there maybe like a week, 2 weeks, maybe. I went in there, her daughters were there, and they wanted the same medication that I was thinking about getting, which is called atropine. Mm-hmm. It's typically for the eyes, but you can use 1 drop under the tongue, and it'll actually dry the secretion, so it makes the breathing a lot easier, and they don't have to fight for air as much, so which is what you want. And so I called the doctor and asked if we could get that prescription ordered or get the order for it. And I started out by introducing myself to this doctor and told her that I needed to update her on this particular patient by giving the vitals and stuff like that, which I started to give her the vitals. And there's a thing called SBAR that all nurses are supposed to follow when contacting a doctor about a patient. SBAR is situation, background, assessment, and recommendation. So the situation, you're supposed to say what is going on, the background, the background of the patient, or maybe even the background of the situation if the doctor knows the patient well enough, like why the situation was happening. My assessment, which would be my vitals I got on the patient, including the oxygen saturation, color of the skin, whether the patient was warm, cold, sweating, whatever the case may be, just for the doctor to make a better clinical judgment on what would be best for the patient, right? So I've never had a doctor tell me not to say those things because they need that. They rely on us to make their calls, right? Just like I rely on a CNA. They see the patients 99% of the time. So I rely on them to tell me if there's a change in the patient as well. And this doctor, Dr. Wells, again, as soon as I started saying off my assessment, like the vitals and what was going on with the patient, she immediately stopped me and was very angry because it was very early in the morning. It was 3:40 in the morning, and she started cussing me out, saying that I should not have called her. It could have waited till the morning, and to have followed protocol, which her protocol was to, I believe, fax over what we wanted, along with like what was going on and why. There's 2 doctors that cover that facility, so there's the other one will take on call like at any time of the night. So, but Dr. Wells, no, absolutely not. So at first she couldn't hear me because her service was horrible because she was laying in bed and I was on a ground phone. So I had to tell her, I was like, I'm sorry, Dr. Wells, I can't understand you. I think it's your phone because I'm on, the landline. And maybe 10 seconds later, you could just hear this loud voice screaming at me, perfectly clear, saying, well, I got out of bed. What do you want? So I then proceed to tell Dr. Wells the issue with the patient. She said, I don't need all that information. What's the point of the call? So I wasn't able to tell her the vitals, what was going on with the patient or anything, and or why I wanted the medication. But she said, get to the point of the call. So I told her, I said, well, I was calling to see if we could get an order for atropine and an increased dose of morphine, actually, because it had been decreased. I remember that now. And then lorazepam, which is a benzodiazepine, and that can help someone in that condition as well, kind of calm them down. Mm-hmm. Again, this patient probably would have made it through the night had she done what most doctors do and allow you to give them the SBAR communication and then make their clinical judgment. Because again, they're getting the same information that they would get if they were there. But instead, she did not want to do that and said that she would come in to assess the patient. So she did, which took maybe 10, 15 minutes. It was actually 15 minutes because the time of death for this patient was at 4:07 a.m. So she walked in very mad and went directly to the patient's room without talking to me, and was in there for maybe a minute. So not enough time to do an assessment, in my opinion. And I can do them pretty fast, head to toe assessments. But when you do a focus assessment, which is what she would have had to have done, it still takes a little bit of time. And she was in and out of that room in no time. But she came out, handed me the 3 prescriptions I had asked for. So had she given them to me or allowed me to make or to update the computer for the orders, that patient would have had a more peaceful death, and a more painless death. So instead, the patient was fighting and suffering and basically breathing in their own secretions, while I was waiting for the doctor to make the call. And in the end, I was given the exact medications that I had asked for. And again, I'd asked for them, which she did say, don't tell me what orders to write, which again, I asked for them. So as soon as she came out of that room, she handed me the 3 written prescriptions, and I started to update them in the orders section of the charting system. And as soon as I started doing that, it was literally not even 3 minutes into me doing that, the patient's family walked out and said my mother had passed. And I just looked at the doctor, and this is, first time I'd ever met this doctor, and I know the face I was making was, I hate you right now, because I felt so bad. And, the patient only been there 2 days, and she only came there for a diagnostic test. And instead, she passed. So that was the first time I had my encounter with Dr. Wells. And, yeah, so.
What was after that first time, what did you work with her more? What was it? What was the work atmosphere like after that?
So,
considering that was the first time you had engaged with her.
Yeah, actually, she rarely comes into that place. So now I worked night shift, so I can't say for certain, whether she's there during the day or not. I heard that she comes in 3 days a week. To me, as a medical director, that's still not enough time. And being a doctor over half of the patients, I feel like you got to be there at least just 8-hour days, maybe 5 days a week would be more realistic, considering the amount of patients and the type of patients. Some in very critical conditions, others, just there long term or rehab to home. But every encounter I had with her since then, the first encounter I had after that with her was very peaceful. And it was like she switched roles and trusted my judgment, because she did allow me to make some orders. I had called, and she allowed me to give the vitals, because that conversation was her screaming at me and me yelling back at her, the first conversation we'd had ever had. And I remember the CNAs telling me, they looked shocked when I got off the phone with her, and they're like, man, we haven't heard anyone talk to her like that in a long time. But, she's not nice to anybody, I was just trying to do something for my patient that was needed, and I wasn't trying to waste time. And that's all it seemed like she was doing. So, but every encounter after that, besides the second encounter, that one was peaceful, and, super quick call, put the orders in, got the medication, everything was good. Every encounter after that, she would be either annoyed, mad that I was calling at that time of night, because I did not fax anything once. I always called her. I didn't care what time it was, because if it's your patient, to me, you're on call, especially if you're the doctor and the medical director. So I always called her. But, I had maybe a handful of phone calls with her in my time working there, and I had only seen her maybe 4 times total out of the time I was there, which is kind of odd, again. So getting in at 6 p.m., I don't know. the last time I saw her was actually the day or 2 days before they had let me go. Mm-hmm. So, and I'll bring that one up too, but,
tell us about, you have a second patient.
Yes. My second patient, that, again, we'll say patient 2, mm-hmm. That was my favorite patient. And I was super close with their family. Actually, I was close with all my patients' families. They all have my personal phone number, and they would text me on my days off just to see how I was doing, mm-hmm. and let me know how their family member was doing within the facility. My second patient that I had with the interaction of Dr. Wells being there and being involved was exactly 30 days after the first one. At least that's what we figured when, So it was June 30th, and it started happening around like 8 p.m. with this patient. They started having difficulty breathing, and they were prescribed albuterol, which it was no issue. Got in there, got a treatment going for them, and oxygen saturation came back up. They had supplemental oxygen, which they absolutely needed due to, one of their diagnoses. And again, when I walked in on my shift that night, that patient had talked to me. He remembered who I was. The family was very concerned because, they were told that he was deteriorating, which was weird because just a few days before that, I was working, and that patient seemed to be, like nothing had changed. Like, yeah, they weren't doing great, but they hadn't gotten worse mm-hmm. from that current status. And that patient was originally just rehabbed to home as well. So they weren't supposed to be there that long. When they first came in, they were prescribed to several antibiotics from the hospital, which was, in my opinion, very much needed, given that they still had that same diagnosis the entire time they were there. Dr. Diane Wells did not continue those prescriptions for those antibiotics. And in my opinion, I think that's what really caused the full deterioration of this patient, because he started to, hallucinate, just odd things. The patient started to not be able to even walk, get up out of bed, maneuver themselves. I'd have conversations with them, and they'd be talking about pink stuff on the walls and, just really odd things. So one day I, just clicked, and I don't know why I forgot, but patients with this specific diagnosis within the respiratory, a respiratory diagnosis, if they have too much oxygen, supplemental oxygen, their CO2, so they hold CO2, so it's CO2 retention, it can increase, causing hallucinations and pretty much every problem that this patient was having in terms of like their mental state. So I did call Dr. Wells. I talked to her, and I talked to another nurse, which was an RN, which I knew Dr. Wells was big on titles. So I made sure it was the RN that was on duty that I talked to, so that when I did call Wells, that I could say, well, myself and the RN talked, and this is what we think is going on. And she was annoyed, but she listened to it at that point, because there's a stigma of LPN versus RN, whatever. And for me, I knew the patient was retaining more CO2 because the oxygen, the supplemental oxygen was, it was actually at 2 liters per minute. She told me to take it down to 1 and to see how he was doing. And she said, just call me back if you get uncomfortable with this situation. And I've been in respiratory care for a long time. I've done several different things in it. So that's actually one thing I'm very comfortable with. So I went in there, decreased the oxygen down to 1 liter per minute. And within, I don't know, maybe 20 minutes, whole mental status changed on my patient. Remembered who I was. They didn't know where they were. They didn't know that their wife knew that they were there, right? But they knew who I was, and they were making sense. So they could have full conversations with me, and remember it and not be talking about random people in the room with us, So again, it was weird when I came in on June 30th and seeing this patient like this, because they weren't like it at all. It was weird to me. And as soon as I walked in, the family was there, like everybody. And I stayed with that patient all the way up until the time he had passed. So, I'd gone to other patients, past medications and stuff like that, but I was in there every 30 minutes. I set an alarm every 30 minutes, and I told this patient's family that I don't want to give them too much morphine, because they were prescribed, again, to 1 ml of morphine every half an hour, which again is not so far from what you typically see, but the patient wasn't on hospice, again, rehabbed at home, and things should have been looked at differently. More diagnostic tests should have been done, but labs were done, and I actually got to review him that day. He was retaining CO2, so it was a good thing that I called the doctor and had that decreased. But anyway, I told the patient's family that I didn't want to keep giving the morphine if this patient didn't need it. But I said, if you guys feel like he needs it, just let me know, and I'll give it. There was a couple of, probably like 5, actually it was 6 times that we skipped it out on the morphine because the oxygen saturation was good. They didn't seem like they were fighting for air. I was still giving nebulizer treatments as well. So it's like albuterol, and kept the oxygen cannula on him as well. And this went on from 6 p.m. till 9:50. It was 9:52 p.m. The oxygen saturation dropped extremely low, and I believe it was at 66% is what it was. And when I walked in there, because the family members came out real quick and they're like, hey, it dropped, it's at 66. It freaked me out, And I was like, there's no way he's going to die tonight. Like, there's no way. And I went in there, the head of the bed was laid down. So with these types of patients who have difficulty breathing, laying down is like the worst position. It's called a Fowler's or high Fowler's position. Mm-hmm. It's a 45 to even up to a 90-degree angle if you need to, but it allows them to breathe easier. So raising the bed up to a mid Fowler's position, and I also gave some of the morphine and then did a breathing treatment, and the oxygen saturation came right back up. So when I called Dr. Wells to inform her of this, at that point it was 88 to 90, which is acceptable for the diagnosis he had. So when I called, it was actually for a prescription order and to also give her an update on the patient. And I, for the life of me, could not remember what the prescription was. I've been trying to remember because I really feel like, I feel like that's important, but I can't remember. So, but it wasn't anything crazy. Mm-hmm. And so she let me get out some of the information I wanted to, and then got upset with me, yelled at me, and said, I can't tell if you're talking to me or if you're talking to the family. I'll just come and assess them. I said, I'm talking to you about the family, telling me, like certain things about what they were wanting. And she just hung up on me. So I went back in there, and again, luckily I was well liked by the family, because I told them, I said, well, the doctor hung up on me, so I think she's coming in. I said, in the meantime, we'll just watch, him and make sure I give him breathing treatments, just anything and everything. We'll make sure it happens. His wife actually at this point asked if she could leave and if he would be okay for her to be gone so that she'd go home, freshen up, and let the animals out. Mm-hmm. And I said, absolutely, I don't see why not. I said, if anything starts to happen, I'll call you so that you can come back down. And so she left, and the rest of the family stayed. And, I didn't actually think Wells was going to show up, because the way she hung up, and she never really agreed to coming in to assess him. She said she was going to, but then it seemed like she wasn't going to. So, I just kept a close eye on the patient, and then I hear the front doors open because it beeps when they do. And I immediately knew it was her. So I went to the patient's room, and I tried talking to her before she came inside the room. She just walked right past me. Didn't want anything to do with me or anything. She did not assess this patient at all. She walked straight up to him, and I walked up right next to her, and she asked me, "What is all this doing on him? Get it off. It's in the way, and it's too loud," which was the pulse oximeter meter, which is the thing that goes on your finger to measure your oxygen saturation. Kind of pertinent in this situation.
Right.
It also shows the heartbeat and, how many beats per minute. And then a blood pressure cuff, which I was having go off. Actually, this one it was on a Daisy machine, so I had to hit it every time. But I checked his blood pressure every time I went in there, every half hour. And sometimes, but even, more frequent than that, depending on if the family needed me or, whatever. We had snacks in there for them and all sorts of stuff. So we were going in and out of the room for those 4 hours. So she started taking it off, all that off of him. And I said, "What are you doing?" I said, he's not dead. And I said, "We need that on him." I said, "I left it on for the family so that they're comfortable and they, just more peace of mind type of thing for them as well." But it was helping me out too, because I was knowing where his oxygen saturations were. And if I was down the hall passing meds, they even came up to me and tell me, "Oh, he's doing good right now." So again, it was very helpful having that on. And I think anyone who would listen to this and who's in the medical field would absolutely agree that should have been kept on. Mm-hmm. So, but again, the pulse oximeter meter was removed from his finger, blood pressure cuff, and then at that moment she took off his nasal cannula, which again, it was supplemental oxygen that this patient absolutely needed, and without it, the oxygen saturation of this patient would drop, and once you get below 80%, organ failure starts to kick in. And again, like I stated, just minutes ago, it had gotten down to 66. So within a matter of minutes, so she removed it, and I'm sorry.
That's okay.
This has kept me up for nights. I mean, every night.
Did she respond to you when you said, "What are you doing"?
No. Last night was the first night I actually got to sleep 6 hours. So the night before that, I didn't even go to bed till 5 a.m. Stayed up all night and then slept for 3 hours. So what I'm about to say, a lot of people are going to probably be screaming at, because they would think they would do something different in this situation. And I always thought I was the person who would do something different in this situation, but my body froze. I didn't know what to do. When she removed that nasal cannula, all I could get out was, "What the fuck are you doing, Wells?" And I whispered it. None of the patient's family heard. She didn't say anything. And she took it off, threw it over the head of the bed. He was still breathing. His last oxygen saturation was, which actually I have a picture of that. So I don't want to be incorrect about that, but can I look that up?
Absolutely.
So last oxygen saturation, June 30th, was at 93%. 93% when she took off the nasal cannula. Mm-hmm. That is more than acceptable. Mm-hmm. And, man, blood pressure wasn't super great. It was 91/56. But again, the condition he was in, acceptable at that moment. Respirations were at 23, temperature 97.5, pulse was 96, which that always stayed kind of high. So 93%, and she took off the nasal cannula because the machine records it, and then we chart it. So when she removed it, she started talking to the family, and in my mind, everything's just running through my head like, what is she doing? Why is she doing this? She didn't even look at him. She didn't even get her stethoscope out, listen to his lungs. And then I realized, I'm like, I only called for a prescription. So like, what the hell is going on? And it, again, was 4 full minutes, maybe a tad over, a tad less. But I did find out that it was 4 minutes that she was talking to the patient's family about nonsense. I mean, nonsense in the sense of like, there's something much bigger going on and we need to take care of rather than just talking to them. And at that moment, when she got done talking to them, she then took out her stethoscope and just put it over both his lungs, which that's not how you do an assessment of breathing. I mean, you've got several spots to go over, and then checked his heart, and then immediately looks up and says, I don't hear a heartbeat. I'm sorry, he's passed. And in my mind, I'm frozen still. And I finally just like snap out of it, and I grab my stethoscope and I go in to basically second her decision, which in a lot of states it's you have to have 2 people second the death. But I found out if it's a physician here in Indiana, they can do it by themselves, right? But if it's just nurses, it has to be 2 nurses. So however, she didn't document the time of death. It was me anyway. She didn't even look at her watch or anything. So she didn't even know what time she declared the death. So it's a good thing that I was even there in the first place. But I go in to listen to his heart, and she grabs my wrist pretty hard too. But, it didn't hurt me or anything. And she said, no, stay there. And I immediately a wave of heat hit my ears and my forehead. I was extremely angry, and I was just like about to just break down. And I managed to just walk out of the room for a second, and she asked them if she could pray with them. And I got a lot of mixed feelings about that too. So I personally believe in God and stuff, but for you to pray with the family after you literally causing their death prematurely is not right. So as soon as I walked out of that room, I asked the QMA who was on shift with me, I handed my stethoscope and I said, the moment Dr. Wells turns her back, check for a heartbeat. And she went in there and checked for a heartbeat. Patient passed. I'm trying to think of...
It's okay. I know, this is a lot.
Yeah. Well, I asked her why she did that so the thing is, I had to call the wife. She didn't answer. The family had actually called her when the doctor arrived and said, come back. So she was already on her way when all this was going on. Dr. Wells then asks, where's the wife? And they said, well, she had left to freshen up and stuff. And she said, well, can someone meet her outside to let her know? First off, I don't know why you'd want to let someone know outside. Obviously they want to know right then,
Right.
But maybe for safety reasons, like wait till you're inside or something. I don't know. And in case it affects them to the point where they can't walk, at least you got a wheelchair there or a couch to sit on, but, not in the parking lot. And I said that I was going to go out there, and Wells tried stopping me, and she said, no, let and then the family members actually interrupted her and said, no, he's good. They said she really likes Coby. And Diane Wells looks at me and she goes, Coby? She did not even know my name. And it's funny because the QMA had overheard a conversation saying, I did not know that was Coby, and that she had heard good things about me from that patient and their family. Because again, I was very invested into all my patients, but this one particularly just because, well, the patient was stubborn, you know, like you want to see them get better. And especially when they're only supposed to be there for a few weeks and then they get worse, you start to, you know, put a lot of like heart into how you care for them and all that stuff. I went outside with one of the family members and we waited for my patient's wife to show up. And when she did, I just saw the look on her face because I was walking up on her. And this has happened to me one other time, but it was a personal thing. I had to go and tell somebody that their family member died, and I just had, you know, you can feel it when you're walking up to them. And she knew already, and I did tell her. I said, I'm sorry, but he passed. And she almost fell to the ground. Myself and the other family member actually put our arms around her and had to hold her up. I grabbed her purse and held it until we got inside, and then I handed it to the family member who was helping me. But she was gripping my hand, I mean, harder than I think anyone's ever like grabbed onto me. So Diane Wells did not stay there but for a few minutes after. And actually, she was leaving when we were coming in. So we were coming in, and Diane Wells met us up at the front door, talked to the patient's mother or wife, and apologized and stuff like that. And as Diane Wells was leaving, the family member started carrying the wife, you know, a little bit, and I said, I'll be right back. And I literally asked Wells, I said, what the hell was that? I said, he was not dead. He was not dying. I mean, yeah, he might have been dying, but he was not going to die that night. And I said, and even if he was, his wife, I told her I wouldn't let anything happen. You know, like I can make someone live a little longer, you know, if it's going to give someone peace in mind to see their family, you know, their spouse one more time. I had everything at my disposal to keep that life preserved for enough time for her to get there. And he wouldn't have passed anyway, that before she'd gotten back, at least, you know. That wife was robbed of that moment with her husband. And Wells didn't say anything. She just walked out that door. So when I asked her all that, though, she looked back at me and then just turned around and walked out.
So she didn't
say a she didn't say a word. Not a fucking word. Sorry. Not even an expression on her face. I mean, it was just, you know, like someone, like, you know, you're sitting there zoning out. You're just blank. It was like that. Just walked right out. So I just blocked it out for a minute and just walked, you know, kind of walked up fast to the wife and the other family member and continued to hold on to her and get her to the room. And, you know, we did our thing there, let them know that, you know, we'll clean the patient up, get them ready for whatever funeral home you've chosen and all that stuff. It took me almost 2 hours to fill out the death certificate, or like the form that we have to give to the funeral home saying like what time the patient passed and all that. Because I was in shock, you know, and that's the situation that's kept me up, because again, I could have done something, but I physically could not move my body. If I could go back and I could do something about it, I would have physically removed her from the room and put everything back on and continue to monitor the patient until that wife got back. You know, whether he made it through the night or not, you know, I don't know if that would have happened. I think he would have, for sure. But again, I just can only imagine how.
So you had that situation happen. So then after that, like, how did you continue to work? Because wasn't there another incident after that?
There were several. So, not like that particularly. So there was, it's kind of in between some of the other ones, but I'll say patient 3. I had this patient I mean, the patient was there the entire time I worked there up until the last 3 weeks, maybe. And this patient was always in a good mood, kind of a fall risk, but could walk, take care of themselves.
And just in the facility in terms of like just getting treatment or rehabbing?
So they were going to be going home. Actually, that patient ended up going home.
Okay.
But this particular patient apparently had fallen one day, and I don't even know what day this was. And, this is one of the things I have on recording too, but this patient fell, cracked their head open, and the nurse on duty called Dr. Wells to inform her of this and said that she was going to send the patient out to the hospital to get stitched up because blood was everywhere, and it was a gash, like it needed sewn. And she said, no, don't send him out. And she said, I'll be there to assess him. And from 4 people, and I trust these 4 people absolutely with everything they say. And in fact, I have a written testimony from one of them. It is anonymous, but they have even said if they get called to testify that they will do that. But as of right now, they want to stay anonymous. But in the testimony, it even states what I'm about to say right now. 2 hours had gone by before Dr. Wells came to stitch this patient. And when she did it unsanitary. Like, she did not wash her hands. She did not put on any sterile gloves. Nothing like that. She just cleaned it with some saline real quick and sewed up the head, and that was it. Didn't send the patient out to get a CT scan or anything, which when you have an injury like that, you send them out no matter what, like right away. And that's not even something I wouldn't even have called the doctor for. But that's one of her rules, is to call her before you send them out. And now she has actually refused me on a few patients to send out, and I totally just remembered one. Wow, there's another one. Man, that's sad that I forgot that. I'll talk about this one next, but this one, patient 3, again, got their head sewn up, barehanded by Dr. Wells, which in the testimony it says as shaky as a Parkinson's patient. And yeah, I mean, you can see her shake when she writes. It's weird that it's like a minute detail that you just notice. Mm-hmm. But that patient ended up becoming very disoriented a few days later, started acting really weird compared to their normal. And so one of the nurses did not call Dr. Wells. They just sent the patient out, and the patient got a CT scan. I believe it was a CT scan, if I'm not mistaken. But they did get a diagnostic test done, so whether it was X-ray, CT scan, whatever. And they did actually determine that the patient had an infection as well, but there was internal bleeding in their head. And that's what was causing the disorientation and, funny talking and stuff like that, messed up vitals, all that stuff. So that's a huge issue and a huge liability. That patient stayed in the hospital for a very short period of time, did come back to Owen Valley, and I believe the patient stayed for maybe 2 more weeks and then was released home, right? Well, not even a week into being home, that patient died. So, and from my understanding, it is due to, it was brain damage, or I think it was brain damage within, that happened from the fall, but it caused the patient to get disoriented and fall, and, they died, right? So, but it was that fall is what caused their death. It was the situation it caused the situation for them to die. Mm-hmm. And again, that patient could have lived probably another 10, 15 years, in my opinion, All
right, so that's patient 3.
Yeah.
Patient 4.
Patient 4 was a sweetheart, and It actually kind of falls on a nurse and Dr. Wells, but I arrived and I always started at one end of the hall. And so this patient only had to wait maybe like, I only had to pass meds to 3 other patients, and then I got to this patient's room. I walk in and they state that they can't see, or they can't open their right eye. And I said, well, your eye's open. And they said, no, it's not. I said, I promise your eye's open. I said, but you're saying you can't see through your right eye? And they said, yes, I told the nurse today, and that nurse even told Wells, right? That's very weird that you just, lose vision in one eye. And I immediately thought a stroke. The patient was, diabetic and had other complications as well. But, it's also not unheard of for a diabetic to lose vision. So I didn't throw any crazy ideas out there because I didn't see any facial drooping, which would be indicative of a stroke. Patient was talking normal, had full function of all body parts, so there was no paralysis or anything like that, or paralysis, I guess. But I kept talking to the patient, and I said, I promise you, your eye's open. And I got my phone out, flipped the camera, and showed this patient. And they said, well, I can't see out of it. I said, okay, hold on real quick. I grabbed my pen light, which is what's used to see if the pupils dilate or not. The left one dilated just fine, normal, as you would expect. And the right one did not budge at all. So the pupil did not get bigger or smaller, which with light hitting it, it should get smaller. The darker it is, the bigger it gets. And I immediately knew, okay, it had to be a stroke. And I did call Dr. Wells to inform her. And that was it. She never did anything about it. So, yeah, kind of strange. And it's sad because what happens next. So I was going to send the patient out. Dr. Wells refused that one. So it was actually the next day that patient had to go outside of the facility to receive a specific type of treatment. I can't say that just the treatment because it would definitely identify the patient. Mm-hmm. So the patient had to leave to get a treatment outside from, different from us. And then they actually are the ones who sent this patient to the hospital. And at the hospital, they found out that the patient had a stroke. And that patient died. Never came back to our facility. So when you have a stroke and even a heart attack, they're two different things. But the quicker the intervention, and usually within the first half hour to hour, is the most critical, If you wait longer than that, any damage that's done is irreversible. And it only gets worse, especially with a patient like this one. Again, diabetes, but weight was an issue, several different things. So I can't believe I forgot about that one. But, yeah.
So that was patient 4.
Yeah. And Dr. Wells refused to allow me to call 911 to have that patient sent to the hospital. Yeah. And you need a doctor's order to send them out, but half the time I don't care about that because it's I don't have time to get your order to send them out when it's an emergency. Yeah. I just don't. I'll send them out and then call, and inform them and stuff. But and I've never had an issue with the doctor saying, "Oh, you shouldn't have done that without my order,"
Right.
Usually you get praised for that sort of thing. So yeah, but yeah, that was patient 4.
And patient 5.
Patient 5, yeah, 2 added. So patient 5, this happened just recently. It's actually what got me to make some more videos and post about this stuff. So originally I had posted 2 videos.
Yeah, so in the meantime, all this is happening, you decide to get vocal.
Yes.
About your situation.
Because I wanted to know if I was blowing this out of proportion. And so I don't get on Facebook or Instagram or anything like that anymore. I pretty much just stick to TikTok, which is weird because I hated TikTok. Well, I hated it. Like just a year ago, I made fun of people who used it, everything. And
It's like the one I'm on all the
yeah,
time. So,
I'm glued to it. So,
But it
and-
seemed like at first, when I very first came across your, it was like you were asking for advice for
Yes,
other
I was.
people that
Yes.
were in the medical community,
Yep.
like just to be able
And-
to connect with other people in general.
I said, doctor, whether you're a doctor, respiratory therapist, nurse, CNA, I don't care as long as you're in the medical field.
Yeah.
I just want your advice. And I didn't say what type of advice. I just want to know what their thoughts were on it. And I mean, I had a lot of people give me their thoughts on it. And, went kind of viral. I think it's at like 20,000 or something like that. But, it's funny that I'm in this situation right now because the job I had before this, I uncovered Medicaid fraud. And if you were to go on my page on TikTok, that's the video that has the most views. It's like 269,000. They ended up getting sued and the family won $4 million because they also caused a patient's death before they even became a patient. They told them to use drugs before they came to the facility, which is not a requirement. You don't have to have anything in your system to be admitted into a drug and alcohol rehab anymore because you could be detoxing from alcohol and not having your system. Same with fentanyl and other drugs because, again, that's what detoxing is. It eventually leaves your system and your body's withdrawing still. So they changed that. It's not a requirement of Indiana or Medicaid or anything like that. So them telling them to use before they come in so that insurance would cover them, yeah, no, it's not a thing. But yeah, now I'm finding myself in this kind of
So
situation.
as you were getting advice, being a little bit more vocal on social media in regards to your situation, then patient 5 happens.
Yes.
Or the incident with patient 5. So
Yes.
tell us about that.
So I walked in to my shift as usual, and I see one of the day nurses still there, which is not uncommon, obviously, because I get in at 6, they leave at 6. But I see this nurse running to the dementia unit, and I was just, was curious. I was like, what's going on? And someone said a particular patient 5, was declining, and that nurse was just had a rough day, and Dr. Wells had given them an order, and that they didn't agree with it, but they were giving it, right? And I was like, well, what was the order? And they said they're like, well, we're not sure yet. They didn't ask. I was talking to a CNA and a QMA, so and a few hours passed into my shift, and I got asked to go back there to help the night nurse who took over for that day nurse with something with this patient. And they just wanted me to kind of they wanted my opinion on what was going on with her. And it had to do respiratory wise. So I told them what to do with it. The patient was just having some difficulty breathing. Mm-hmm. Blood sugar had dropped, which they had given glucagon shots for, and that actually raised it up. I know they had some issues with keeping it up, but again, that's all that was going on. So some slight respiratory distress and blood sugar dropping. Respiratory issues were fine after we had talked about it and got everything figured out. That patient was looking right at me. I was talking to another staff member, and I said, is this outside of her normal? Is she acting different? And they said, not really. But that patient was in pain. And so that patient's allergies, which I actually misspoke on one of my videos, I said penicillin, which that was not correct. It was another medication. But the other ones I'm about to state, those are correct because those were the ones that stood out. So this patient had an allergy to morphine, oxycodone, and fentanyl. And if you have, that's pretty much what they prescribe in a nursing home for pain, other than hydrocodone, which is Vicodin, or tramadol, but that's even an opiate. It's a non-narcotic opiate. They say non-formahabine or whatever, but it is. And in fact, you can get addicted to it. So, but this Dr. Wells, prescribed morphine to this patient. And when I saw that night nurse coming up with the little syringe that you would squirt into the mouth, one walking up with it. At that moment, I had asked her, I said, what are you giving her? And she said, I'm giving her the morphine that Dr. Wells ordered. And by this point, when they had asked me to come back there to help them, I actually looked at the patient's chart real quick just to see if she was a DNR or full code. Full code is where if, they start to die or whatever, you give them CPR, anything and everything you can to bring them back. And I saw the allergies, and I always look at the allergies. You should always look at the allergies. Every nurse knows this. And I went back there, and that's when I questioned the morphine. And they said, well, Dr. Wells prescribed it. And I said, she's allergic to it. I said, so I wouldn't be giving that to her, because it doesn't matter if you're allergic to it, whether it causes an upset stomach, which some doctors in some facilities will make it an allergy if it's like a preference, right? Mm-hmm. I just get really itchy on that, so I don't want to take it. They put it as an allergy, which they shouldn't do that in the first place. But if it's listed as an allergy, regardless of whatever it is, you don't give it. I, again, have proof of that being on there as her allergies. And I also have proof that Dr. Wells is the one who signed the order and sent the order. I have the actual order. But that patient only declined more and more as she received more and more morphine. So, and it did not help with the respiratory issues. So, which I know that's why they were giving it for pain. That's what it was listed as under the orders in the system, and for, to help with breathing.
Did that nurse question the decision from Wells, or?
I did ask her that, and she said, I know she's allergic to it. She's like, but, she said it could be just an allergy that's simple though, right? That's what she said, and that's why I brought that up. So, and I won't name this nurse because this nurse is a good nurse, very good nurse, and if she ever sees this, hopefully she...
Well, I mean, if you're in a situation like that and you have a doctor telling you, obviously you're thinking, well, she's a doctor. She's been in this field for so long.
Exactly.
She must know way more than I do, so there's obviously a reason she would be prescribing this to this patient.
And that's exactly what that nurse had even said too. She said, well, she's the doctor, and it's an order. Most people wouldn't even think to look at the allergies. They'd be like, oh, the doctor. They wouldn't even think of the allergies.
Right, because you would think the doctor would
have done that.
All of that.
Yeah. And the other thing is, though, again, when the doctor orders the medication, we put the order in, and then once the order's put in, it basically transfers over to the pharmacy we use. And the pharmacist sees the patient's profile to an extent, not everything that we have, but they see their allergies. So the pharmacist should have stopped it as well and questioned it. Or even the pharmacist can actually override the doctor's order and not give it at all. So I don't know why that didn't happen, or why there was no communication on that part between pharmacy and a nurse, or the pharmacy and the doctor, or just anybody at all. I was the only one who questioned it. And I know that for a fact. I'm the only one who, because I was very skeptical of Wells at this point, obviously. Every chart that I had, and it said their doctor was Wells, I looked at their medications, I looked at their diagnoses, everything. I made sure these people were being given the correct medications. Again, I'm not a doctor, and I know a lot of people will be like, well, yeah, he's not a doctor. Why would he, even think whatever? But again, I know my medications, which is why I kind of talked on that earlier, better than most people. So when I questioned it, she brought up that, the doctor prescribed it. And she had even said, she said the doctor knows her allergies. And she said, and then I think it might just be a minor allergy. I had a lot of things going on that night, so I couldn't really get to looking into that. But I was told that it was not a minor allergy from 3 QMAs, 2 nurses, and someone from leadership. I can't say who, because again, they do not want involved in this at all. But again...
Is patient 5 okay?
Patient 5 passed.
Oh.
A day and a half later. Okay. Excessive deaths under this doctor's license.
So now you have multiple deaths in a short amount of time.
This is, yeah.
And so now that leads you to, making it even more public on
Yep.
social media.
Yep.
So walk us through what happened after that point until today, because then it kind of gets a little
it
crazy
gets
for you.
it gets horrible. So I make that. So I have 4 videos on what I call the Doctor Death series on my TikTok page, and the third video is talking about the patient with the allergy to morphine, and you can hear my voice completely gone. I mean, I'm having to like kind of scream to get some things out. I don't know what that was. I wasn't sick, didn't feel sick, but I did start to notice weird things started happening to me. Now, first off, I started receiving death threats telling me to leave the Dr. Death situation alone. And
When you say you're receiving
phone
death,
calls.
so people found your number.
I don't think they found it. I think they were given it. And I think it was given to them from someone within Owen Valley. Yeah. Because how do you just get my phone number? I'm a very private guy. Mm-hmm. Like, I don't like anyone calling me. I don't give my phone number out. If a telemarketer or someone calls from like 20 or 15 years ago, I'm like, Coby who, So, no one gets a hold of me unless.
You had multiple calls telling people.
I had.
Or people telling you.
6 or 7 calls and then 1 physical attempt on my life. So, the 6th call or the 7th call. Did I say 7 calls and 1 attempt? So it was 8 total at this point. The 7th one, they mentioned my family members by name, including one of my sisters. Yeah. So I called my sister as I'm on my way to work. I'm freaking out because that's when it happened. And so it actually happened the same night as the 8th one. So I'm just realizing that. But I called my sister and told her, I said, I can, my wife is in the military, so we carry, I mean, obviously not right now, but so we protect ourselves. And I told my sister, I was like, hey, I need you to come over and pick up, a firearm to protect your home or whatever. She said no. I said, well, I'll drop it off. She said no. So I was like, okay. I was like, well, just know that they said your name. And she took me seriously because she could tell. I mean, I was frantic. I was freaking out. So I told her I'd call her back because I had horrible service, always do on my way to work in Spencer because it's just back roads, right? As I'm on my way to work, literally, it's all back roads up until you get to this main road, which I can't remember the name of it. I could look it up, but again, it's like the main road that runs through Spencer. So once I turned left or right on that road, the first light, there is a gas station and then a car dealership. And I'm sitting there just minding my own business. I was actually on TikTok refreshing my page because I was like, dang, man, getting all these views. And I was, reading all these comments and stuff. And I start hearing what sounds like a car hitting just, I don't know, random things. It just, you could hear it. You know the sound of a car hitting something or cars hitting each other. I look over to my left and I immediately see this black SUV just popping over the curbs of this car dealership. I don't know if they were parked there or if like they were behind the dealership because there's like a little area I noticed where, and I've looked at it a few times driving back, that night, where you could like sit and kind of like just hang out. But they like bounced over these curbs and I thought this guy was drunk. And I was like, oh my God, I was like, what is going on? And I'm still at a red light and the oncoming traffic on the other side was at a red light. So it was the side ones crossing. It was a 4-way stoplight. But that car did not stop and they just kept coming full speed. Actually, it got faster once they hit the road because, again, they weren't hitting anything anymore. And I knew like they were coming right for me and I was like, holy crap, I need to move. So I just hit my gas, ran through the red light, and as soon as I went through that red light, I got my phone and I was still holding it, but I exited out everything, dialed 911, and I was calling to alert them of a drunk driver because that person had to have been drunk or on something, right? And I'm on the phone with them, and as I'm telling them I need to report a driver I need to report a driver. They're on, I don't know why I can't remember the name of the road because I even had to look to tell them. And I said, I'm between the Speedway and then there was a restaurant that we were like in between those two shops, right? And then I noticed in my rearview mirror that this car is almost like right up on, like they're about to hit me. So I hadn't paid attention the entire time, right? Mm-hmm. And so I hit the gas and I swerve a bit to get out of the way. And I just kept that speed up, kept going faster. At this point, they actually turned out to like get, I guess, momentum to hit me because they spun or like they sped up, come to the left of my vehicle, and then swerved into the end of my vehicle, almost hitting me. But again, I sped up as they like bowed out and hit grass, and I think it is like on the side of the road. So it was like rocks and grass. But I was off the road at this point, and my tires spun out on my truck. And then luckily I was able to get straightened back out pretty quick. But that all, like all as that is all happening, I'm telling the lady, this person is now trying to hit me. And then I tell them real quick, I said, I don't have time to say all of or explain everything, but I've had death threats the last few days. And I said it has to do in regards to a doctor I work with at the facility I'm going to right now. I think, I said they told me, to leave the situation alone. I said, I just need police to come out and help me right now. I said, this guy is trying to, kill me. And I just went with that because why else would they be coming for me, But that car, it was a black SUV with an older guy, mid-60s, like I had said to you before, just kept coming at me. And luckily, the road's not very long, like the distance I had to drive from that light to where I had to turn. Mm-hmm. But once we get past that gas station, which, was coming up while I was on the phone with dispatch, and I stayed on the phone with them the entire time, one cop was across from us, like, over on the other side of the median. He was watching this whole thing go down. And so he got up to us pretty quick. And then another one, again, there's always cops around in this area. And their police station is actually like right over there. I'm not sure where, but I've talked to one of them before and they said it's literally just minutes down the road. So we had two officers behind us in no time. I mean, it felt like it all happened in like it all happened all at the same time almost, The first cop that had saw all of it actually chased the guy in the black SUV, and that guy went behind a store, which I believe is actually the back of Walmart, because it is the back of Walmart, because I could see it behind the gas station. But when you turn right and then go down, there's like Casey's and Walmart and stuff like that. They never got the guy. Yep, and it wasn't like a government SUV. A lot of people are like, "Oh, the government's after you." It was a crappy Chevy looking SUV, like a old Chevy Blazer. I mean, it wasn't. I say crappy because of how old it is. You know? But it was in good condition, I guess. But anyway, the second cop followed me to my work, which was again Owen Valley. And as soon as I pulled up into the parking lot, so there's like a long stretch of road and then the building with the parking lot, I stopped because I didn't want anyone seeing me talking to a cop. Mm-hmm. And just because of the situation I was in. I didn't know who I could trust, but I pulled over. He pulled up against like the side of me and said, "What did you do?" Like laughing and stuff. And I immediately told him, I said, "I'm on the phone with dispatch still." I said, "I need to talk to someone. I need to file a report and press charges." I said, I've had multiple death threats regarding me talking about issues that have been going on here with the doctor. And I said, which is the medical director. And he said, "Well, that wouldn't be me." He said, "I'm fairly new still." He said, "But you would want to talk to a detective." So they actually sent a detective, and I did tell dispatch and that other police officer, I said, when that detective gets here, he needs to call me and I'll come out and meet him. I said it like 4 times, and I already knew like the administrator was going to have an issue somewhat if the cop came inside and saw patients. Because again, like the whole HIPAA thing. Yeah. But again, it's also a cop. Right. And someone just tried killing me or running me off the road. And I've been getting death threats about your medical director who has had excessive deaths just in the past 2 months of me working here, And I'm uncovering a lot of this stuff so it's not coincidence at this point. So anyway, the detective actually just showed up at the nurse's station. I don't know who let him in. It wasn't me, because I was at the nurse's station getting a report and counting the narcotics in the narcotics drawer. And he walked up to me, scared me half to death too. And I even told him, I was like, holy crap, you scared me, man. And he said, are you Coby? I said, yeah. He said, so you're the one I need to talk to? I said, yes. And I said, can you give me just a second so I can finish counting these? And I look over my shoulder when I say that, and I see the DON, Director of Nursing, and the administrator just eyeballing me as if I just, I don't know, robbed them clean or something. I knew I was in some trouble, but I did, like, for what though, but I felt it. And him and I talked in a private room, and I have some of that on recording, and that recording actually laps over to me telling the Director of Nursing everything, where she seems very concerned about my life and all this stuff, and ensures me that I'm okay, I'm not in trouble. She just wants to make sure that I'm okay, and that I'm okay to work, and that my mind's there for the patients and stuff like that. And she just acted shocked and about everything I was telling her, like a genuinely concerned person. I'm glad I had it on recording, because, she said I was safe, that nothing would happen, all that. Right. Obviously the detective had left at this point. He filed a report, or he said he was going to file the report on the death threats, but everything else, like pressing charges on Dr. Wells and all this other stuff, I needed to do like in person with them, which was the Owen County Sheriff's Department. Mm-hmm. That's who came out. And then I also needed to do it with Spencer's Police Department, and then go to the state police, the Bloomington Post. I mean, I'm sure I can go to any state police post and do it though. And anyway, so, we finished that conversation. I told her all that stuff. And as we're walking out of her office, I said, now I'm sure you're going to have to tell Ed, which is the administrator, or the administrator. I keep saying that. I don't really care if his name gets out there, because you can just look it up. It's on their page. So, anyway, she said, yeah, I'm going to have to tell him something. She said that she was going to tell him that the detective came to question me to get a report because someone had tried running me off the road. Right? Not a big deal. And I even told her, I said, I told them not to come in. I said to just call me and I'd meet them outside, because I didn't want anyone seeing this or, thinking anything bad. And she was like, yeah, I was freaked out. She said, I was concerned for you and all this, Well, a few hours passed. I mean, it was 4 hours. It was at 10 o'clock when the administrator walked up to me and said, hey, Coby, can I talk to you for a minute? I was like, yeah, what's up? He said, well, get your stuff real quick. Or actually said, get your glasses if those are yours. I said, okay. And I grabbed my glasses, put them on. And he said, what else did he say? He said, oh, and your grapes, because he had saw me eat a grape at my cart, which you're not really supposed to do. So I was thinking, is this really about grapes? And but anyway, I grabbed them and I said, do I need to grab anything else? He said, yeah, anything you brought. So immediately I was like, motherfucker. I knew right away she told him, because he would not have walked me out. In fact, every time he had talked to me, he always talked to me as if he respected me. I mean, he would talk for 30, 40 minutes. And I'd be like, I need to go count my drawer and get a report. And anyway, the guy had always been nice to me, very respectful until this point. He was very rudely sarcastic, and I got all my stuff. I turned around and I said, you're walking me out of here, aren't you? And he said, yes, I am. He said, you called the cops and you had them enter the building. I said, no, I didn't. I said, I called the cops because of what happened. I said what happened. Yeah. And I said, they came, or I said, someone let them in. I didn't let them in. I said, you saw me at the nurse's station. And then he repeated himself 3 more times. And I said, yeah, Ed, I called the cops and I had them come in. I said, well, yeah, whatever. And he said, exactly. He said, that's why you're leaving and you're not slandering Dr. Wells. So, yeah. And I couldn't get my phone out fast enough to record that. But I do have recording of one employee. I'm not going to say their name just yet, but I have that on recording on my phone of them saying that is the very reason that I was fired. Obviously, I mean, he said it to my face, but having it on recording does help because at this point I am considered a whistleblower and you are federally protected from retaliation. That is exactly what they did as soon as they got the information that I shared with them.
Right.
And they've been checking my TikTok like crazy. So,
So after this, so have you filed reports to all of these stations
Yes.
that you're supposed to?
So I've filed with all the appropriate outlets besides one right now, only due to the process of filing that one is a bit slower and tedious. So the ones I have reported to is the IDOH, which is the Indiana Department of Health. And actually, they will be doing something about the stuff I reported to them. I can't say much on that because it does happen unannounced.
Okay.
So, but I did report to them, full report of everything. I reported to the Indiana Department of Labor for the retaliation on a whistleblower. And I've already gotten receipt of that, and they will also be doing an investigation on that. I've reported to the state's attorney general, and I've received notification back that they will be investigating this as well. And there's one more. Well, the police report as well, and then I'll be doing more of those too.
Did you meet with that? I thought you said you were meeting with another detective as well.
Yeah. So
Because is it from there where when you have this meeting with the detective where if they see your evidence and then you can press charges against her?
we could, yeah.
Okay.
Or I could go about it with once the state's attorney general actually does. So once they do their job, so I thought I had to report to the licensing board separately, but they actually handle that on themselves.
On their own, okay.
So once they come to a conclusion, they'll hand it over to the licensing board, which they will then get I forget what it's called, but it's basically just a group of other physicians and stuff to make a determination on this physician's actions and to remove her license and any further, what is it? If anything else needs to happen
Yeah. Besides
legally.
just getting
Yeah,
her license taken away.
Yeah, which I've been getting more and more proof because people have been coming out more and more, like I told you earlier.
Right.
One gentleman actually wanted his name to be out there. He's a former employee, and it is astonishing at how his testimony is a lot of what I just told you.
Really?
Yep, and it would happen during COVID and even after COVID, around that time. And I mean, this doctor is known as Dr. Death by the town, her patients, and even the coworkers that she has. So it's
So the patients even call her that?
the ones that have been there for a while. Yeah.
Wow.
Yep. Yeah, it's pretty crazy. Which
So obviously I'm sure obviously the facility and the people working there and her know of all of this going on.
yes.
Do any of the police departments or the investigators let her know, like, hey, we're going to be investigating you? Like, does the attorney general go to her and say, hi, we're officially investigating you for X, Y, and Z? How does that process work from what you know?
I know with the IDOH, no, not with them. The Department of Labor, they do up to an extent, it said. However, I know they have to basically do an investigation unseen for a certain amount of time to, because I mean, them retaliating on a whistleblower, they're obviously going to say no to these things, like these accusations, right? But they did say that they will be alerting them at a certain point, and that I'll also get alerted with, documentation and stuff like that, and then I'll also be told of the end result. Same with the IDOH and the IDOI will be, which is the Indiana Department of Insurance. When I do file with them, it's going to be the same way, but they will actually alert that doctor and their insurance, because again, that's who's going to handle that. So with the issues that I've been dealing with mentally, like psychologically, not sleeping, I literally, I break down every day. There's not been a day where my kids have seen me not cry, which I hate saying that. You know, my wife's going to be very shocked that I said that. But yeah, I'm not a crier, but every day it's multiple times a day. I'll have to go to the bathroom just to hide, just because I don't want my kids I don't want them seeing me like that.
Yeah.
And it's all over that's this patient number 2. So, yeah, so I do plan on, making a lawsuit against her, 2 different specific lawsuits, one specifically for me, and then one for the family as well. So I don't know if so. Well, I guess I can give you this, the testimony from the other guy.
That would be great.
I'm going to be sharing it with my whole platform and everything too. So, but yeah, I've reported to all the appropriate agencies, and I've done everything I am supposed to do legally. Now, I may not have done it in the order I was supposed to, because I've never really done this except for Medicaid stuff, which actually I can report her to Medicaid. I forgot about that too. So
now is it that you just have to wait to hear back from the investigator?
I do, yes.
Did you submitted all your evidence that you have against her?
There's more coming, so I have help. So there is a few more things I'm waiting on, but yeah, they have everything that I've told you I've had, things that I've shown you as well. And again, I have recordings that I've sent them as well. So they have. I mean, to me, it's a done deal,
right? And you just everything's a matter of
absolutely
time.
And there's I've contacted a few attorneys. They've both turned me down.
What is there reason behind?
Well, one said that they didn't think it was done by email. This one, they didn't think that the employer had actually done or fired me for any, like, there was no wrongdoing, and the reason as to why they fired me. I said, well, no, I have proof that they fired me because I leaked this information about the negligence, malpractice, and premature deaths, or the excessive premature deaths under this doctor who's the medical director. I said, that is a direct retaliation on a whistleblower. I was like, that is like the clearest definition.
Right.
And so they are reevaluating it, and I've not heard back from them yet. It's been 2 days since that, but I am looking for an attorney. If I have to, I will represent myself. I'm very confident.
There's going to be an attorney that will reach out to you.
I'm sure there will be. So I'm not doing this for the money. I want her license stripped away from her. I don't want any more patients or families suffering just because this doctor has a license that gives her the mindset of that she can do whatever she wants. All the testimonies I do have, they even say the same thing. She is a danger and in imminent threat to society as long as she holds that license.
Why do you think she is doing this?
Me and 100,000 other people have an idea, but I don't really want to say it because it's kind of crazy, but realistically, I don't know. Yeah. Realistically, I don't know. Maybe she just has lack of empathy and doesn't really care anymore. So if she thinks they're going to die soon, she's just like, you know what, let's just end it real quick for him then. Yeah. So in her mind, she may be doing it for a good reason.
Right.
And obviously it's not, though.
Yeah.
But yeah, we can all convince ourselves of things if we tell ourselves it enough. So I have no idea. I hope I find out. So,
Okay.
Yeah.